there's so many different AI companies that are out there today. And every time I turn around, there's another startup, there's another company, there's somebody that's developing something to try to make, something more efficient in the revenue cycle. And it's hard to kind of decipher who's got something that's going to work, who's got something that's going to actually provide value. And if you're sitting there and saying, I'm going to try to pilot this and try to pilot that, I think there's a lot to sift through. So I think one of the hardest things in our space and in revenue cycle is knowing what works and what actually you should try yourself, right? And I think if you look at different health systems and they don't have time, they don't have the resources, they don't have the manpower to say, I'm going to try these different 10 solutions and I'm going to put a team on each one and I'm going to figure out how this is going to work. And then I'm going to buy the tech and then make it work. We all know that health systems should be focused on delivering care and not on the administrative side of this business, right? So when you're taking resources and time away from doing the clinical aspect of it and trying to put it into the administrative side and trying to figure it out, that's a difficult thing to do because that's not your core business. You have to work with companies that can try to bring that entire solution to the table that says, I will take this off your hands. I will build the best technology for you, and I will do the human in the loop component so that you have the entire solution and you're not just buying a technology and trying to figure out how to use it. Agentic AI for me, at least things that I've seen that are working right now is, so when we call a payer, we actually have the agentic AI listening to the agent. And it's then prompting the agent to make the next right move with that payer, try to get the claim resolved in one touch. The moment you have to touch it the second time or the third time, it costs a lot of money. So if you can figure out ways to make it better and more efficient by guiding that person to make the next best move, you're creating efficiency, right? The other thing that you're doing is you're listening to the call the entire time. And as the agentic AI is listening to that call the entire time, at the end of the call, that person doesn't have to sit there and like, okay, now I better summarize what I listened to. The summary is done, right? So then that's a lot of what you can see on, your phone, or there's so many different apps for that today. But that is the type of thing that you're getting now into the agentic AI piece, is you're making things more efficient by utilizing the technology that is at your fingertips to make things better and make your outcomes better. Today, I'm seeing a lot more around agentic AI and utilizing technology to kind of do the human component of it that's being done today, where you can get claim status or you can talk to payers. You can do things that are more utilizing bots and agents. And now the payers also have bots and agents. And I think we're going to be in a point where bots are going to be talking to bots soon.